So I'm going to hand over to Max, who is going to introduce herself and share her screen. And just before she does that, I want to thank her very much for making herself available, because she's incredibly busy and is involved in an incredible amount of initiatives. She's going to talk a little bit about that in the coming hour. So thank you very much for being here, Max.
Thanks, Reinhard. Thank you so much, and thank you so much for the invitation. And as Reinhard mentioned, he was probably one of the first people. I was probably one of the first people he touched base with, and it's just incredible to reflect. I think this summer school is a great opportunity to reflect on just how far it has come from. On Saol has come from the germ of an idea, and I suppose really born out of the lack of a service and the lack of a support, and my utmost admiration to Reinhard, his family, his friends and supporters for what they've managed to put together in On Saol. I'd very much like to be there physically present with you today, and it's one of my long-standing ambitions, COVID notwithstanding, to get out and see the centre in On Saol. So hopefully the next time I'm speaking to you will be physically in the building, because certainly something that I really want to do. Reinhard has asked me to give an overview of the Neurological Alliance of Ireland, and first thing I'm guilty of is what I always accuse politicians of, is showing old photographs of themselves. So I realise I really need to update my cover picture, because that's a few years old at this stage. But I suppose what it does indicate is how long I have been with the Neurological Alliance of Ireland. It's coming up on 20 years at this stage. Which has disappeared really in the blink of an eye. Really, it's been, it's like your own journey, Reinhard. It's probably just progressed quicker than than you'd have thought, because it's busy and there's so much to do and there's so much still to do. But I'll give an overview of the Neurological Alliance, and as I say, we've plenty of time then towards the end for any questions. So just bear with me for a second. I'm just going to share my screen here. Okay. Okay. So everyone still hear me okay? So the Neurological Alliance, I've just a little picture there on my opening slide of a meeting that I held a couple of weeks ago, where Reinhard approached me and he was looking to promote the work of the centre to the NAI membership. And I suppose that's something that's key. When I was describing everything that the Neurological Alliance of Ireland does, I just had to kind of take a step back and realise that it's as much about our member organisations and linking them to each other. And there was certainly a very good response that day. We just opened a Zoom call for Reinhard to talk about the service in On Saol. And there was a lot of interest from NAI member groups who were, oh yeah, we know they're NAI members, we're not too sure what they do. And I hope there were good linkages just from that meeting. I suppose that was something just very simple and straightforward that we can do in the NAI, and we sometimes don't think of the importance of linking voluntary organisations to each other and establishing those linkages, because voluntary organisations and charities are very much what stakeholders do we need to engage with. And almost, taking a step back and going, who is in our community that we want to link with? So I'll talk a little bit about the Neurological Alliance. There's us recently in the Joint Committee on Health, and that's one of the more visible pieces, I suppose, of our work. But as you're all aware, there's so much pain, sweat and tears that goes into something like that before you get that opportunity. But certainly something like that is very useful to get focus and attention, and I can certainly send on the recording of that particular session. We were in the Europe's Committee on Health on being in the invitation of the committee to discuss the impact of COVID-19 on neurological care, and I suppose that gave us a lot of scope to talk about the entire neurological care services and how they've been impacted by COVID, but also stressing, and I'll come back to this later on, COVID really, I suppose, tipped neurological care services into highlighting the lack of supports, the waiting, increasing the waiting list. As Reinhard and I'm sure many of you are aware, the problems are endemic and the shortages are endemic across neurological care. And I suppose, COVID, while it highlighted them, I suppose it threw them into stark reality. The problems were long-standing, and that was something that we stressed to the committee. But it's a good opportunity, and it was a good opportunity to highlight the kind of things that we've been saying over and over again about the need to properly resource and develop services for people with neurological conditions. So just as a starting point, the Neurological Alliance is the national umbrella for neurological charities in Ireland. We've over 36 member organisations. They're all coming from the community and voluntary sector, and they include on Saol and also a number of other organisations directly supporting people with acquired brain injury, the likes of Headway and Acquired Brain Injury Ireland. In terms of our main activities, I suppose our raison d'etre really is advocacy. And by that, I mean shining the spotlight on the services for people with neurological conditions, highlighting the gaps, highlighting what needs to be done, trying to generate policy where there are gaps, and trying to implement existing policy. And I suppose there was a time in our innocence when you felt that getting a policy developed was the end goal, that if you got a national strategy or a national framework, that was it. You'd arrived and things would happen and things would get better. I suppose what we realized over time, like other sectors, is getting a policy is only the start. There's a long and slow road to implementing that, to getting the funding year on year, to keeping the momentum going. And I'll talk later on in the presentation just of some of our stumbles and our obstacles that are ongoing in relation to that. In terms of research and policy development, again, that is the key, because certainly when I would have started, and as I say, it's coming up on 20 years ago, there was very little, and it's surprising really to look back on now, there was very little in terms of a policy framework for people with neurological conditions. There wasn't even, and it's incredible to kind of think on this now, there wasn't even a recognition that there was a commonality of people with neurological conditions having specific needs and experiences. I'd come from, originally I'd come from working as an assistant psychologist as a very young graduate student in Beaumont Hospital. I'd worked with people with a range of neurological conditions. And then I was working in voluntary sector. I'd come through the Health Research Board. But I almost thought something had happened in the meantime. So 10 years between graduating and starting the world of advocacy, I presumed everything I'd come across as an assistant psych, as a trainee, of people coming to a national centre, a national neuroscience centre, as it still is, coming to the neuropsychological services, which are still there, albeit much more developed, and just not having a service to go forward to, being assessed with a range of needs. And then hearing from the staff throughout the services, well, there isn't, that this person is from the west of Ireland, this person is from the south of Ireland. There really isn't, a lot to be sending them back to. They're coming here for an assessment. They've been diagnosed with XY condition. And it was when I moved into the Neurological Alliance in 2003, I realized there was a lot of things happening here. And one of the things was that there wasn't a policy, there wasn't sufficient policy around the management of neurological conditions. They fell between stools. They were managed in general disability services that really didn't have the understanding, or the group, the team of personnel and the dedicated services to manage the needs of these individuals. And I suppose one of the things that particularly interested me and still inspires me about the Neurological Alliance, with its membership of community and voluntary organisations, is that impetus, that drive to develop services has come principally from the community and voluntary sector. And the mainstream health framework has really raced to catch up with that. It's recognised that there were an emergence of organisations mushrooming on the ground to respond to a need. And a lot of the time, these charities were developed by family members, by small groups of people, recognizing that there wasn't support when something happened to them. Exactly Reinhard's own situation with his family, and developing something in response to that. And then it was almost that the health service had to catch up and realize, okay, we need a policy framework around meeting the needs of people with these conditions within the health system. And I suppose NAI's work has been that driving that impetus for a policy framework, getting that agreement to put policy frameworks in place, and then the long and slow, painful work of getting the implementation on board. But it starts with organisations, and that's something that I would emphasise. It starts with organisations like on Saol, putting, I suppose, being a fact on the ground, meeting a need, and then policymakers realising, okay, there are a group of individuals with specific needs that aren't being met, and we really need to put a framework and services in place to support that. And despite the policy frameworks that have been put in place, it's still very much that situation 20 years on of the community and voluntary sector plugging gaps and meeting needs on an ongoing basis. In terms of member support and networking, as I say, we are the national umbrella for those 30 odd member organisations. The member support, I suppose, I'd be happier if I could put a tighter definition on what it is that we do around that piece. So the others, I suppose it's so clearly able for me to identify what we do in terms of advocacy. You can see the dedicated campaigns, you can see us in Leinster House. You can see all the media work that we do to raise the profile of neurological conditions and the need for services for people with neurological conditions. Again, with the research and policy development, you can see our sitting on our working groups. You can see the final product. I'll talk a little bit more about a research project we have at the moment, just starting off. But I suppose it's so much more tangible. The member support and networking is something it's hard to pin down. As I say, it can be an organisation lifting the phone to me and saying, we're looking to put together a campaign, can we have some advice on this or some input on this? I'll talk a little bit about the training that we've been able to provide to our member organisations, quite a recent training programme. The networking opportunities of bringing organisations together around a campaign. So something the organisation, I can't take this on my own as an organisation. It would be much better if we could link into something. So we've had member campaigns, or as I say, I'll talk about our most live and current one, the Patients Deserve Better campaign. But again, it's something I suppose we need to get better at measuring the support that we provide to members. And one of the things we're really, really focusing on, we focus on specific things within each 3-year strategic framework. And one of the things we're particularly concentrating on in our next strategic framework, which is starting to build this year, is that member support piece. What do our members actually need and expect from us in order to do their work? And how can NAI be effective and impactful? Because I suppose something that I'm conscious of as well, and again, with that, 20 years under my belt within NAI, is the plethora of umbrella organisations that exist out there, each doing a very different thing and providing a unique support. But just getting an understanding from members of what are they not getting from other umbrellas that is a key role for NAI, and just remaining relevant and effective for our membership. Because at the end of the day, our members are who we are accountable to. So just as a backdrop, in terms of neurological conditions in Ireland, that figure of 800,000, that's from a very old, but I suppose our most solid piece of published information. Sad to say, it's a 2007 report that was published by the HSE, a strategic review of neurology and neurophysiology services back in 2007. And they did a very rough paper exercise of what were the estimated numbers of people with various neurological conditions, and projecting, they projected up until 2021, and by that it was that there were something like 830,000 people in Ireland with a neurological condition. But again, we don't have hard and fast prevalence data for a lot of the neurological conditions. So this is very much extrapolating for countries where they have done proper prevalence studies, and then extrapolating from the Irish population to that. Very much an Irish solution of estimating really how many people are living with neurological conditions throughout the country. But there would be, as any of you in this field know, we're particularly bad at that, in Ireland in general, in terms of proper prevalence studies for health conditions. There are very few medical conditions that we have proper prevalence data for, and neurological conditions are no exception. But I suppose we can say that up to 50,000 people would be diagnosed with a neurological condition each year. And we would look to, just putting down some information there, that the World Health Organization, they published one of their updated statements in 2021, and they identified the neurological conditions as the leading cause of disability-adjusted life years worldwide. So the World Health Organization has very clearly recognized the impact of neurological conditions. I'll talk a little bit more about the presentation, because we're on the cusp, I suppose, of what we consider to be a leap forward by the World Health Organization. They're looking to put forward a 10-year framework, worldwide framework for the Global Action Plan for neurological disorders and epilepsy. And there's a key vote coming up on that later in May. But that's really, there have been statements, there have been papers. I suppose the most recent one was 2004, where they did a specific report on neurological conditions, public health challenges. But this is really, as I say, we're watching that report on May 24th, and then it will be, well, how does this filter down? What's it actually going to mean for Ireland, for European countries, for Ireland? And I'll talk a little bit more about a worldwide campaign that we're involved in, in terms of highlighting that World Health Organization framework, and being involved in, within our own countries, in highlighting that and in trying to get action for that, so that trickle down from the recommendations of the World Health Organization to what Ireland actually does and actually puts in place. So I won't go into too much detail on this, but I suppose I put up all these, and this is just, this is not all by any means, but I suppose what it does represent is the dedicated and strategic frameworks around neurological conditions in Ireland. You can see there's not probably that many. And I suppose it is important to say that there are multiple other policy frameworks, policy documents that would have strong implications for people with neurological conditions. The plethora of disability, mental health, any health policy that you can think of relates to people with neurological conditions as users of health services. But I just wanted to put these down, I suppose, to just identify these are policies that NAI has been directly or indirectly involved in the generation of, and again, they're a response to that gap in policy for people with neurological conditions. I suppose one of the things that you can see straight away is that we tend to divide. So not just by condition. So you'll see that there is a national dementia strategy, there's a national stroke strategy, but also between, I suppose, different continua of the services. So there are separate frameworks for neurology and for neurorehabilitation services. And I suppose what that, it's understandable, and neurology and neurorehabilitation, just as an example, are quite distinct and quite different services. But I suppose what it does is there is no joined up framework around neurological conditions. We don't have an overall strategy, or like a cancer strategy or something like that around neurological conditions. What we have is quite a fragmented policy landscape, and it means, I suppose, that in terms of of advocacy and in terms of policy, we're scattered around. We're advocating for different strategies. They're all at different stages of implementation. And very much my role in NAI, it's frustrating in a way, because I'm not advocating for one thing and for one policy. There's all the different ones, all at different stages of development and implementation. All interrelated, but it can be frustrating to give that unified message. And sometimes it's really when you're speaking to media or speaking to that layman's audience, and they're saying what needs to be done, and you get into this whole complicated scenario around well, the neurorehabilitation strategy needs to be implemented, and the neurology program, and the model of care for this, and and we particularly see it when this what is effectively the same type of service is fragmented across a number of different policies, and that's particularly with neurorehabilitation. So the stroke strategy, for example, refers to the need to implement the neurorehabilitation strategy. The trauma strategy will say we can't do effective trauma care without neurorehabilitation. But again, it is very scattered, and it's that unifying piece that NAI is trying to do, of trying to look across this policy landscape and give that overall message about what needs to be done. With this, I suppose, with the system working against us to a certain degree in terms of that fragmentation, and particular stakeholders leading particular pieces of work. But that frustrating piece in terms of direct service users, patients and families, wondering why there isn't progress, and just getting very, very disillusioned and very fed up with that complex policy landscape of why can't it all just come together into better care. So just a couple of observations. As I say, that fragmented advocacy and policy landscape with no overall strategic approach to neurological care, and it's something we step back and look at dementia and see that they've actually done quite well in terms of having that overall strategic approach and having everyone pretty much singing from the same hymn sheet and looking for similar types of services to be put in place, and having a good momentum there. And there's certainly lessons from the dementia area and other areas of health advocacy in how we can do things better and take that learning on board. One of the things, I suppose, just as an example, and I don't want to go too much into the whys and wherefores and how our health services operates, but just as an example, we have about 31 clinical programs. So these are clinician-led initiatives. They're looking to put policy frameworks in place to coordinate service development. They're a plethora, as in some of them are condition specific. So there are clinical programs for stroke, there are diabetes, but there are also clinical programs in areas like mental health, neurology, rehabilitation, medicine. And if you can imagine, there are 5 or 6 that have direct implications for people with neurological conditions. So there's a dementia program, stroke program, neurology, rehabilitation, medicine, and epilepsy as well. And again, it's that complexity and trying to bring some kind of uniformity and strategic direction to those different initiatives and programs that are happening all over the health services, and where is it all moving towards? And I suppose it is that disadvantage in a way. There are historical reasons for it, that neurological care has become that fragmented. You don't see that level of fragmentation in the likes of mental health, for example, and particularly in the likes of something like cancer care. the neurological care has become very much, as I say, led by individuals, to a certain extent fragmented, different initiatives here and there, all of which can be positive in some ways, because you can get an initiative in one area that kind of lifts all boats and shows the way for others. And we've seen that in epilepsy, where they've pioneered a number of initiatives just within epilepsy that are then the learning can be transferred to other neurological conditions. But as I say, it does make it difficult for that overall keeping an eye on all the pots piece that we have to do in the Neurological Alliance of Ireland. Again, it's the challenges that anyone experiences in terms of health advocacy, changes in roles, staffing changes within the HSE, that you're just not sure sometimes who is leading what, and who you're reporting to, and who can really be the change makers. And I think that's something that happens in every organization, particularly in larger organizations. You have to deal with those kind of things. But I say it's an added complexity when you're building a relationship as an advocacy group, and then some key person in the HSE moves on, or their role changes, and you almost feel like you're back to square one in making those relationships and generating that awareness. In terms of that, the lack of agreement that lies outside of scope, we seem to be there seems to be a particular curse within policy. I'm not sure if it's unique to Ireland, but we certainly seem to have the situation where when you're starting a piece of policy work, a policy framework, straight away someone will tell you that's outside scope. That's not what we're dealing with here. And then you're I suppose catching up later, saying, well, this is unfit for what we needed it to be, and you're always kind of pushing back against that. I suppose it's that kind of stakeholder engagement, and really, what are the plans suiting? Are they suiting the people providing the service, or the people actually in receipt of the service? And again, that whole level of complexity within any big system, and our health services are like any organisation. They're a large, complex system, and it's about understanding those operational strategic roles within health service. I seem to have, in my time in NAI, been through so many iterations of HSE structures and who's reporting to who, and certainly those clinical programs that I mentioned, each of those have what's called a program manager that's responsible for essentially running the program with the clinical lead. And again, I've seen quite a few program managers come and go, and they seem to spend their first 6 months at least trying to understand how the HSE works. And how they put submissions into the estimate process, and some of my job seems to be, giving them these training almost, and how the whole thing works and comes together, and then they're off to something else. So again, I suppose it's just to give a sense of the day-to-day with that kind of advocacy role. And as I say, you have this sense that if you have a strategy, that's it, you stop. We have our plan, it's great. Whereas that's only the start of the process, is trying to get that implementation in place and deal with those ever-changing system. So within that, what does NAI strive to do? Well, again, most of our energies are around the advocating for the implementation of existing policy. And we do have strong existing policy in a number of areas. And as I say, it's that constant keeping in touch, keeping it live, keeping it on the agenda, making sure that successive service plans year on year have a reference to neurological conditions and are moving forward incrementally in the implementation of policy. That second area of highlighting areas where policy is needed, that's a huge challenge, and that's something that we're doing on an ongoing basis, is identifying gaps where there can be an overall strategic approach, but it's just not fine-tuned enough to understand the needs of people with neurological conditions. So again, that's something that our members play a key role. They'll often see something down the line, and they'll draw our attention to this is a policy framework, an overall policy framework, something like home care or statutory right to home care, or personalised budgets. And we really feel there isn't the people with neurological conditions aren't visible within this. It's not highlighting their unique needs and experiences. And it's not that you develop tailor-made policies for each group, but you certainly want particular challenges and particular experiences to be reflected within the development of a policy and also within the rollout of a policy. And again, that's something that we do that ourselves, but we also work in partnership and increasingly in partnership with other umbrella groups. So, for example, we work closely with the Disability Federation of Ireland, who have a very broad disability agenda. And we're increasingly bringing that very positive working relationship. We bring that kind of neurological niche or that neurological information to inform that broader disability agenda and just increase their understanding around that. And also another area would be rare disease, which again, I suppose the particular issues and challenges for people with rare neurological disorders within that broad framework of rare disease. But it's something that, as I say, it's always needing to be done. There's always something new coming around, or there's a point where policy has started to be implemented, and it's only when it's being rolled out or a service is being rolled out that the challenges for people with neurological conditions are apparent. I just have a small picture there on the right-hand side of a webinar that we did late last year for employers around understanding of neurological conditions in the workplace. And we'd over 360, I think, attendees at that webinar. We're blown away with the interest, but that certainly flagged. And coming back to us after that, we did it with an organisation called AHEAD that supports people with disabilities in the workplace. And is focused on greater awareness and training with employers and educational institutions as well around the needs of people with disabilities. But we certainly just scratched the surface of a huge demand among third level institutions, employers, training institutes for awareness training, I think, around neurological conditions. And I suppose there was a sense that they're so complex. How can we even start? We'd need separate training sessions on migraine and separate training sessions on epilepsy. But one of the things we did with that webinar was we invited representatives from our member groups in about 5 of principal neurological conditions. We had MS, acquired brain injury, Parkinson's disease, migraine, epilepsy. And you could see a lot of the commonality, a lot of distinctiveness of these conditions, but also a lot of the commonalities in simple changes that could be made in the workplace to promote job retention and to promote recruitment of employees with neurological conditions. And as I say, what I was talking about earlier is that key piece of supporting our members and just learning more about how to do that as well. I'm going to talk about current projects, and I'm just keeping an eye on my time here. The one that's supposed very, very much fresh in our mind. I have a good few of these to get through, so I won't concentrate too much on any of them. Brain Awareness Week is something we do year on year, and we've really managed to build this. I suppose it's one of our achievements in the Neurological Alliance of Ireland. We've managed to build this very much as a recognisable awareness initiative. This year in particular, we had the Understanding Together, the HSE campaign around dementia awareness come on board for Brain Awareness Week and work with us. So again, that was very positive, because that shows that all of the groups involved in neurological care, in the main neurological conditions, are now recognising Brain Awareness Week as a national awareness initiative that they can come on board with. Similarly, we had Creative Brain Week coming on board as partners to work with us. That was an initiative of the Global Brain Health Institute, again working in the area of dementia. But I suppose these are the real heavy hitters, and they're recognising that Brain Awareness Week is something that's established, and it's to work with us as that 1 week in the year where we're not talking about one single neurological condition. We're not we're not talking solely about Alzheimer's disease or epilepsy or multiple sclerosis. We have that 1 week where we can give those general messages about all neurological conditions. And this week, this year in particular, as I say, we exceeded our targets in terms of our coverage, our receptiveness to the week, building our partners. I won't go too much because I don't have enough time just to go into some of our achievements from the week. But certainly, just for example, the media coverage for NAI alone, for NAI's activities alone for Brain Awareness Week and for March in general in 2002 exceeded the media coverage for Brain Awareness Week in total for 2021. So we definitely managed to make a mark with Brain Awareness Week this year. And again, that's testament to groups realizing that there is a need for an overall awareness week where they can promote messages about whether it's about the need for more research into neurological conditions, the good research that's happening, the need for more services and supports, the work that's being done, the innovative work that's been done by services on the ground. Whatever your message is, Brain Awareness Week is a platform and a resourced platform by NAI to highlight those messages. So as I say, it's growing year on year. I'm just going to speak briefly about this because it's something very much in my mind because we're launching the mapping survey tomorrow. This is a project we're doing in partnership with the HSE and with the Disability Federation of Ireland. We're mapping, or to put it more accurately, we're aiming to describe the services provided by voluntary organisations to people with neurological conditions within each CHO. So we're delving into, we've over 44 organisations signed up for our mapping survey, which, as I say, will go out tomorrow. And I hope it's okay to say, Reinhard, that on sale is signed up. But we're excited about this project because I suppose for the first time it's going to capture the in-depth range of supports provided by the voluntary sector. We constantly hear from our members, people don't understand what it is that we do, or there isn't enough awareness and appreciation of what it is that voluntary organisations do. This will lift the lid on the richness and depth of the services provided by the voluntary sector. It'll also highlight areas of the country where there is less service provision happening. And it's also, when I say it's a basis for future mapping, it will, I suppose what we're looking to do with this project is, rather than a very constrained view of what rehabilitation is. So rehabilitation includes the peer support, the transport, all of those different supports that are provided by voluntary sector organisations, the seminars like today's, and making sure that those are captured in that picture of voluntary service provision to people with neurological conditions. And then the second part of the project, which would start over the next couple of weeks, which I'm really excited about, is to identify examples of innovation and collaboration. So organisations working, yes, the mapping will capture what they do themselves, but a further qualitative piece will look at how organisations work with each other and with the HSE in collaboration and in best practice and innovation, and just doing things a little bit differently in response to need. Again, I'm flying through these because I'm just conscious of my time and taking questions. This is our most current campaign. It's a campaign focused on specialist nurses, increasing the number of specialist nurses in neurology services. But what I suppose I want to stress is that this has been a very effective overall campaign template. So again, it's focused on building support in regional constituencies. And then it's very much a grassroots, because it's relying on people to contact their own local TDs with a resource tool through that website. But it's been particularly effective because it's almost like it started backwards. It started in the regions and built towards that ROGERS committee hearing that you would have seen in March. So again, what we're using is that template, that campaign template, as the experience for future campaigns. So looking at our advocacy agenda and gaps in service for people with neurological conditions, how can we take what we've learned from the Patients Deserve Better campaign? And we've secured 16 additional nurses just this year alone. And we're looking to, as I say, there's an overall shortfall of 100. So we're looking to reiterate that message and build on that number. And we've an AV room coming up on the 15th of June around that campaign. COVID Impact Project, that's coming on board later on in the year. I suppose we're all thinking COVID is done and dusted and done with, but I suppose what we want to do in this project is explore just what the implications have been in terms of patients, in terms of providers, and just an overall impact assessment. This is something that we're all very eager to forget about. But what were, warts and all, what was the impact of COVID on the experience of people with neurological conditions? Their, as I say, their lives living with this condition in the background, but also any changes to service provision for good or ill into the future. So we all know that it increased waiting lists, for example, but did it also lead to innovations in service provision that we need to learn from? And we tipped off this a little bit last year, but it's something that we're looking to do a proper project in the second half of the year with service users and with their own organisations. So we certainly link with our organisations around that. Just very briefly, we ran a neurological training network. Again, that was something very much we did in response to COVID. So realising that our members were confronted with a very, very sudden need to move a lot of their services online, not only direct service provision, but also administrative services, HR, communications, fundraising. So we responded with a training program, the bulk of which was delivered in 2021. And that's just, it allowed us to buy essentially specialist training, particularly for our neurological member organizations there was no charge really. There was initial sign up of about €200, but then the training was free to our member organizations. So we trained over 200 staff in the NAI network around all of those areas, using online training, and we've had really, really positive feedback around that. This is just something that's coming up. World Brain Day. The theme of it is Brain Health for All. It's coming up very rapidly on July 22nd, and we'll be certainly getting the word out to our members around what they can do potentially for World Brain Day. We don't really see it as big as Brain Awareness Week, but certainly because it is such an inclusive theme, we will be doing an event around World Brain Day, and we'll be promoting the week within our own social media within NAI, and just giving opportunity for member organisations to get involved if they want to as well, because I suppose it is particularly a very inclusive team. The World Federation of Neurology that runs World Brain Day would have went with a very condition specific theme up till now, but when we saw this one coming up, we were like, we can't miss that. That's something very inclusive and something that all our members can get involved in. This is a worldwide campaign we're involved in, One Neurology. It's aiming to increase awareness of the need for services for people with neurological conditions. It's very much focused on providing a common evidence base and common tools. It's very much a European-led campaign, but it does have worldwide membership. And I suppose the upcoming vote in the World Health Organization and the adoption, we hope, of that 10-year framework for neurological condition and epilepsy, it'll give a real focus to that campaign, because I say at the moment it's just awareness, things like the slide that's just in the right-hand corner there. But the Global Action Plan will give, I suppose, some targets for that campaign to really get behind, rather than just general messages around awareness. I'm just giving this very, very briefly, because again, I'm running into my question time. The neurorehabilitation strategy, again, I suppose I'm just very conscious of the group I'm talking to today, and the direct implications of this for the services that On Sale provides and what it really fits into. It's something that Reinhard is very, very aware of the stops and starts and the stops for the implementation of the neurorehabilitation strategy. It's something we highlighted in the Oireachtas committee presentation in March. I'm happy to provide further information because I know I'm out of time today. But just what we highlighted in March in the Oireachtas committee was just the abysmal lack of progress on the strategy. So, for example, one of the things in the strategy was that the community neurorehabilitation teams would be funded within each of the community health organisation areas. And you can see from the map and on the right there, just how little progress has been made. And even those green ones, the 6 and 7, CHO 6 and 7, teams were funded in those areas since 2019, but they haven't been established on the ground. So again, part of our advocacy work on an ongoing basis is to highlight the lack of progress on the implementation of the neurorehabilitation strategy. And we've had that very frustrating experience of the role changes and the staff changes and just ministerial changes and just everything stopping and starting. So this is nearly my last slide when I stop for questions. I'll say just in terms of our new strategic plan process that's starting at the moment, we are really looking in that plan of listening to our membership. We feel it's a very, very key time. COVID has changed a lot of things. Our members faced a huge challenge. They're still facing huge challenges in terms of sustainability. So we want to really ensure that the strategic plan is built around, rather than slotting in with existing frameworks and keeping on just the way we're going. We really want to do that check-in piece with our members this year of our relevance, our impact. Are we really doing it for them as an umbrella, and how do we need to change what we do, whether that's being more engaged with members or what it is that they're doing. So I think I might stop there. I just left some contact details for NAI, and just inviting people to visit our websites and follow us on social media just for a progress update on everything that we do. Okay, so I might, as I say, I might stop there and just take any questions that people have.
Yeah, thank you very much. Thank you very much, Max. It was a real comprehensive overview of well, the vast amount of work that is on hand. Really, it's a bit frightening. I think what you described there, so much, and as you said, you cover so many different conditions in such a, not just such a vast landscape, but also you talk about 30 or 31 or so clinical leads that you have to work with. So it's a humongous task. I don't know, Oren, if you can hear me there, but there was a question there.
Yeah, there's a question there from Rosie. Rosie, if you want to unmute yourself, or I can ask the question for you.
Yeah, I can unmute myself. Can you hear me okay?
Oh, hi, Rosie.
Hello, Mags. Thanks for your
time. I'm due a call with you, I know.
It's okay. So I guess what I should say before I ask my question is, I've spoken to On Sale here and there about this, but I haven't actually confirmed anything with them. So excuse me if I'm speaking out of turn. But my contact with the brain injury community has highlighted travelling to Dublin from all over the country for various outpatient services. Like, the brain injury community finds that quite exhausting and impossible to maintain. And they express a lot of disappointment and frustration at the lack of services available locally. So I would like to know how I can best advocate for the west of the country, because Cork, Limerick and Galway have significantly limited access to community rehabilitation services. And I've emailed you about this recently, that I know JP McManus does a lot of altruism around the Limerick area. And I'm just kind of have an idea that maybe NAI could come together with On Sale, and that we could get in contact with JP McManus to look for some financial support and assistance to establish maybe an On Sale in the west of Ireland, or maybe something like setting up On Sale around the different CHOs could be an idea for the future. Again, I'm sorry for putting On Sale. I know I'm being a little bit cheeky, but it's like you have to be sometimes.
Well, thanks, Rosie. I'll have a go at answering, and then I might put to Reinhard his longer term legacy plans. Look, certainly you've absolutely highlighted. It comes back to that lack of implementation, Rosie. That if the neurorehabilitation strategy was implemented the way it's supposed to be, we would have those community neurorehabilitation services throughout Ireland. It is that frustration, and I would get calls. I got a call a couple of weeks ago from a person recovering from stroke. His wife was a nurse, So she knew what to do. She was supporting a bit of his rehabilitation in the home, but he was actually being referred to older person services because of the lack of community neurorehabilitation services. He was being referred to older person services 2 counties away because there weren't community neurorehabilitation services for stroke in the county that he was living in. So look, I completely, whatever practically we end up doing, and I'm willing to have conversations with anyone. There's certainly, I'm looking at the campaign that we're running, the Patients Deserve Better campaign, and I'm already speaking to sponsors around, can we use the learning from that to really give an impetus to neurorehabilitation advocacy? We're at the very earliest stages of discussions at this stage, but I think what you're highlighting is just that failure of implementation, which has been so frustrating and so disappointing, because the direct result, sometimes all this can feel very lofty, these discussions around policy and frameworks, but the reality, the real implications for people is that they don't have a service when they need it.
Well, thanks for asking the question, Rosie. I won't spend much time talking about, because we have to finish to let our next speaker get set up and everything. But that is actually part of what we have. We have proposed a 5-year plan as a follow-up of the pilot project that is going to finish by the end of this year. And part of that 5-year plan is an expansion into other parts of the country with satellite centres.
Excellent.
And I'd be more than happy to talk to you and Max and maybe other people who are interested in it, and to JP McManus about how to do that best, and the HSE, obviously. And that's something that's going to happen. Yeah, it is going to happen. It takes an insane amount of time for it to happen, and it was just very frustrating. But anyway. I think we have to wrap up, because there's only 2 minutes left to 2 o'clock. What remains is just again thanks to Max. Send a big thank you to Max, not just for her presentation today, but for the incredible work that she's been doing. I didn't know it was 20 years.
Coming up on it next year.
It's amazing. It's absolutely incredible, and it's a real, it's not just the NAI, but an institution in the country, and it's fabulous to have a person like you coordinating all the voluntary sector and see the development of it, and celebrate the successes. Not just be frustrated, but keep at it. I think that not to give up after 20 years and still keep going and having new ideas. That's truly it's fantastic, and really big loads of reasons there to congratulate you on. We have to celebrate that next year, then the 20th anniversary. Yeah.